Welcome to Medical Dialogues. I'm Roshni Dhar, and today I'm going to talk about an interesting case of a 32-year-old woman who was admitted to Fortis Hospital Kalyan on 22nd of January after being transferred from a local hospital due to severe left flank pain, vomiting and septic shock. She had low blood pressure, restlessness and high blood sugar levels and was diagnosed with diabetes for the first time. A CT scan revealed Emphysematous Pyelonephritis, a rare and serious infection in her kidney tissue with gas in her renal vein. The team led by Dr. Pradeep and Dr. Pradeep Patil stabilized her within 24 hours, addressing the multi-organ failure she was experiencing. To talk to us in detail about the case, we have with us Dr. Pradeep Vyavahare, consultant urologist, Fortis Hospital, Kalyan. Welcome to Medical Dialogues, Doctor. Doctor, can you tell us the case history?
This 30-year-old female, she presented to our hospital, Fortis Hospital, Kalyan, in the casualty department with septic shock. Means her sugars were high. 580 was sugar, then she had low BP, altered consciousness, and her counts were high. She has severe pain in the abdomen, left line, and she was restless. And then immediately she was shifted to ICU. Then we resuscitated her. Then she was put on the medications to improve her BP. She was put on oxygen. And immediately her CT was done. Of course, blood test revealed counts high. Her platelets were quite low. 40,000 were platelets. Total counts were high. Creatinine was high, 3. And then CT was showing there was a gas in the left renal parenchyma. Means there was a gas involving left kidney, and the gas was going in the vein of the kidney. Now, why this has happened, we don't know. She had gone to outstation beyond Delhi, and there she started pain in the left flank, and then she had a vomiting. She traveled to Delhi by bus, and then she took a flight to Mumbai, and then came to her residence in Dombivli a day before admission, and then subsequently this has started. So in ICU, she was resuscitated, and then in view of her clinical findings and history, we suspected there is a septicemia, there is a septic focus in the left kidney, and which has probably going into the body. She was landing in multi-organ failure. We immediately put a stent within 2 hours of admission. Stent means a tube inside the kidney from her urethra, with the intention that this will help her in reducing the septicemia, gas and septic problems. But that didn't help. Throughout the night, she landed up in anuria. There was no urine output. Her condition deteriorated throughout night. Then she was put on dialysis to improve her kidney function. In the morning, she had heartbeats which were irregular and which were very high. These are observed in patients with advanced type of infection in the body, that is atrial fibrillation. She developed atrial fibrillation. So all these things were going against her health. Only thing was that though she has altered consciousness, but still she was conscious and maintaining on supports, all support system. So we again did her CT. We showed increased gas in the parenchyma and in the renal vein. Vein means the vascular structure which drains the blood from the kidney to the inferior vena cava. So that's this renal vein was full of gas. With such kind of picture and deteriorated condition, we had no option but to propose them that we should go ahead and take out her kidney, which is a focus of infection, and that is the best chance for her to survive. And then we talked to the relatives, we counseled them, and we said that there is a very high risk in this surgery because she was in septicemia, she had a heart problem, she had a very high sugar. All things were going against elective or any type of surgery, but still we have to take a chance because she is a young lady with such kind of bad septicemia. So we took a decision of nephrectomy. Fortunately, relatives gave their consent, So with high risk consent, we take her on the table. We did her nephrectomy within 2 hours, within 24 hours, but the surgery took only 2 hours, skin to skin.
Right. So what were the major complications you faced?
Major complications is that one thing was that she was not maintaining her saturation. She was not maintaining her BP. So throughout the procedure, she was on medications to maintain her BP, to maintain her oxygen saturation. Her platelets were low. 10,000 were platelets on subsequently. So we had to give her platelets and fresh closal plasma as well as transfusion to maintain hemodynamically stable. So these were the things. So chances of bleeding were high. Of course, she was very high risk for anesthesia because all her parameters were against surgery. So with such kind of thing, we took her. She had some bleeding, but we could control it well. Then on table, of course.
Right, doctor. So what are the prognosis? Is the patient well now?
Subsequently, what happened then after surgery, we finished the surgery in 2 hours. But then post-surgery, she was on ventilator for 12 hours because her saturation, oxygen saturation had to be maintained. But she had shown improvement. And after 12 hours, she was put off ventilator. She was maintaining saturation later on. She improved her urine output. Her platelets gradually improved over 4 to 5 days. And her creatinine was gradually going down. Now, after recovery, her creatinine was within normal range. That is 0.9 after 10 days. So this is a unique case in the sense we have seen the emphysematous pyelonephritis. That is a very bad infection of the kidney, which is observed in diabetic patients. But when there is a emphysematous, that is a gas in the kidney, the gas which goes into the veins, IVCs and different vessels, these are observed very rarely. Till this date, 17 cases in the world are reported of gas in the venous system of the body because of emphysematous pyelonephritis. So ours is the 18th case in the world where there is a gas, and when there is a gas, this is a dreaded complication of emphysematous pyelonephritis. If left untreated, it leads to death.
Right. Thank you so much, doctor, for your insights. The case was managed extremely well with tremendous efficiency and expertise of Dr. Pradeep and Dr. Sandeep along with their team. Salute for giving new lease of life to the patient. That's all for today. Stay safe.